A very warm welcome to all the participants and the panelists, and on behalf of the Ahmedabad Management Association and the Gujarat Vidyapith, it's a real pleasure to welcome you all. Our panelist, Dr.MuratTuzcu, who is a really internationally renowned cardiologist with the Cleveland Clinic, USA, and now based at the Cleveland Clinic, which is equally big, and the extension of that at Abu Dhabi. And so we are disturbing on this Saturday, but it's so kind of you to consent to participate. Dr. RameshKapadia, the founder of the Universal Program and Ahmedabad's one of the oldest cardiologists in Ahmedabad. Welcome, sir. And we have two very highly accomplished academicians in the Gandhian studies, and that is Dr. Sudarshan Iyengar, the former Vice Chancellor of Gujarat Vidyapith, and the current Vice Chancellor, Dr. Anamik Bhai Shah. Welcome to you all, sir. Basically, for the participants, thank you so much for sparing your time on this Saturday morning. And it's really a nice thing that this is held on a very auspicious occasion of the Navratri festival. Dr. Tuzcu, you might be remembering once in the Navratri time you are in Ahmedabad. Yeah. So these are the auspicious days. And our basic format will be that it'll be kind of a panel discussion between Dr. Murat Tuzcu, who will be asking some basic questions, and Dr. RameshKapadia will respond. So it will be a question answer dialogue. And like everybody else, we have also in the new normal. So for the UHP program, we have all that physical. Yes, we did have live broadcast in the past through the internet, basically in the past. But it is first time that the speakers or the panelists are remote anyway. So now coming to the main topic, because I don't want to take much of your time. And of course, Dr. Sudarshan Iyengar will be introducing both these panelists after I finish. So that will be there. So Universal Program was founded in 1991 by Dr. RameshKapadia, and he was inspired by none other than Dr. Larry Dorsey and Dr. Dean Ornish of USA, who had just started a very strong movement about prevention of coronary heart disease in the US. And the main elements or components of the UHP include the selective diet control, the exercises, and then the yoga and the deep relaxation, and what in the Indian terms we call as a savasana, and also the group discussions and so on. And most important, coupled with the modern Western or allopathic medicine, which, and besides statins, those were in those days in the 80s and 90s, but today there are lots of medicine. So it's all done. And this has helped many patients, to live a very stable life. Patients of coronary heart diseases or heart attacks or whatever you call them, they had a very stable life. And in many or most cases, the intervention in countries like India, which is very costly, was also avoided. And through research and how this program evolved, it was proven actually that the practicing of the UHP is very effective for the prevention. And of course, that will be discussed by the panelists. And I will like to add that Dr. Kapadia has been associated with the Gujarat Vidyapith for many, many years. And Gujarat Vidyapith is a Gandhian university founded by Mahatma Gandhi exactly 100 years ago. And in 2017, Dr. Kapadia established the Universal UHP Center over there. It's a physical center having a room where people congregate for not only for the meetings, but for their regular, twice a week, or days to come for the exercises and savasana. There are proper tutors. So that itself is doing. And this day, we have selected, the webinar on UHP signifies 4 very important milestones. The very first milestone is the 100 years of the Gujarat Vidyapith or the Gandhian University. The second is that the Universal Healing Program started in 91. So now it is completed 3 decades. So that's another big celebration. And the next one is Dr. Kapadia's cardiology practice, which started in the year 1965. So that completes a big 55 years and going strong. Dr. Kapadia at this age, 86 now, is practicing regularly in the afternoons where a lot of people of his age would be actually resting, but he is doing this full time. And last and the most important part is that on 26th October, Monday, is Dr. Kapadia's 86th birthday, sir. Wishing you a very, very happy birthday in advance. And because of this milestone, the volunteers of the Universal Healing Program and Gujarat decided that each year it will celebrate it as the Universal Healing Day, So a very, very, once again, happy birthday. And this will be a celebration each year. And before I hand over, we will be, playing two, video clips, messages of from Dr. Larry Doshi and Dr. Samir Kapadia. Besides being Dr. Ramesh Kapadia's son, he is a highly accomplished cardiologist lived in the Cleveland, USA. But before we play these videos, I'll also mention that, on Monday, or, the soft copy of the book, Heart Disorder, will be sent to the participants in a soft copy format. This book's title is Heart Disorder. And the basically the subtopic is well-being of coronary arteries, and prevention is better than cure. And before I hand over another 1 minute, I'd like to take that, as from I'm an engineer, and the engineer's perspective, heart is a pump. So I will just lead the first 3 lines of this book, which are very, very touching, that the heart is where life, love, poetry reside. This center of love, life, poetry plays the role of a pump in our life, a pump that works endlessly until our last breath, a pump that keeps us alive. So this is the wonderful description of the heart. So now the panelists, talking about the heart. So hum bolenge ki dil ki baat dil se karenge. And now we will have the 2 video clips, and then I will hand it over to Sudarshan Bhai for the introduction. And once again, I thank all the panelists and participants. Thank you all. Radhika, the clips. Yeah.
Universal healing.
Yeah, this is Dr. Larry Doshi's message.
So it is my honor to congratulate Dr. RameshKapadia for his establishment in 1991 of the Universal Healing Program, and now this new center at Gujarat Vidyapith. This program is a shimmering jewel in India's already transcendent crown. My wish is that you continue to make vital contributions not only to individual health, but also to the perpetuation of life in the largest sense, the health of our fragile species on our beloved home, this great earth. I cannot imagine a greater contribution. Thank you.
Now, Dr. Samir Kapadia's clip.
Hello, everybody. Good morning. This is my great pleasure to introduce the Universal Healing Day as Daddy's birthday today. And we are trying to celebrate this Universal Healing Program that started in 1990s. From 1990s, a lot of changes have happened in cardiology. Stenting became available in United States in 1994. And since then, we had drug-eluting stents became available in 2003. So there were several changes that happened in the management of cardiovascular disease. Statins became the primary method of prevention of coronary artery disease, both for primary and secondary prevention. So with all these changes, the Universal Healing Program has also evolved. Initially, it was the primary method of treating coronary artery disease. Then it embraced all these changes, including revascularization, including prevention of coronary artery disease with medications. And now it has focused on way to change life, way to embrace changes in people, give them motivation to prevent coronary artery disease with yoga, with proper diet and proper exercise, along with medical management. Many of these patients benefit from this holistic approach. And more importantly, now they are expanding to prevent coronary artery disease in young people who are not yet patients. So this is a great occasion, and I'm very happy and proud that Gujarat Vidyapit has contributed tremendously to this program, and now there is a center for universal healing program in Gujarat Vidyapit, which is again a great accomplishment and a great support. I really thank everybody who is celebrating this event, and my best wishes to Daddy for his birthday, and happy Universal Healing Day. Thank you.
Yes, thank you. Sudarshan Bhai, please. Yeah. Sudarshan Bhai, you are on mute. Sudarshan Bhai, you are on mute. Yeah, that's okay.
Yeah, thank you. Thank you very much and welcome to this wonderful program. And now we take this program forward, and I'm very, very thrilled to introduce two very eminent persons who are in the field of medicine, practicing so well professionally, but not in a reductionist mode the way sometimes medicine has become. Instead, Dr. RameshKapadia has been introduced very well. I'm just going to add a few things that he is of that generation which has seen freedom struggle as a young person. He has been actually in an environment where he got the best of values in life, brought him nearer to Gandhian thought, and Gandhi has been living in his heart ever since. So even after getting thoroughly professional training, he thought that his ultimate aim is to provide service. And this service leadership quality has led him to think beyond what only can be done medically. So what he developed ultimately is that heart requires intervention, cure, treatment, but also it requires healing. And healing comes from actually a practice, a way of life, and relaxing, keeping the body, mind, soul for in peace, in harmony, and making efforts to develop that. And this he did. When he did, he took, of course, he came to Gujarat Vidyapit, where he had got the inspiration from the then Chancellor Morarji Bhai Desai. So his association began, as he has said, in 1991. The Universal Healing Program slowly evolved. It has caught on, and it has immensely benefited the society, given confidence to people. And the cost saving, I would not mention it. It is just a side issue. But the whole issue of giving new hope in life and confidence in life and changing the lifestyle, which is important for healing and for the harmony that we are seeking. So Dr. Ramesh Kapadia is not only seeking a medical solution, but he's actually talking about a human solution. That makes him Gandhian. I had no hesitation in inviting him to Gujarat Vidyapit's Peace Research Department and Gandhi Philosophy Department as an adjunct professor. He has honored us. And since then, we have also taken this initiative of Universal Healing Program at Vidyapit. There are so many admirers that resource was never a constraint. He would not admit, but I must tell you that he put his own resources into this. So it's really a creation. It's really a creation of heart. So that is Dr. Ramesh Kapadia. He is going to be 86. We wish Shatayu Bhava, as we say in our language. May God bless you with health to live for 100 years, which is our tradition and our culture's hope. So with this, we will be very happy as Vidyapeeth has Universal Healing Program Center to continue this your birthday of the 26th October as Universal Healing Program Day. So we welcome you, sir, for this panel discussion. Now let me say something about Dr. Murat Tuzcu, young person. He is just 59 or getting 60 and a very bright person originally from Turkey. And again, I must tell you that whatever brief interaction I have had with Dr. Tuzcu, I am nobody to actually give his credentials, which are really wonderful. He is a trained MD. He has studied in Harvard Medical School, taught there. He's he's in the University of Pittsburgh. He's everywhere actually. He's professor of medicine. He's fellow of the American Cardiologist Association, Turkey Association, and of course he's a very well internationally recognized expert and expert in intervention cardiology. He has great research projects. He has trained so many students. He's a committed educator, and he has impressed so much that Abu Dhabi people said that we will give you the infrastructure, doctor, promise us, and you come and take charge. So right now he's professor of medicine, chief academic officer, chairman of the Heart and Vascular Institute in the Cleveland Clinic, Abu Dhabi. It's a wonderful person to have with us. And as I said, another similar kind of a characteristic, openness in looking at the alternatives or supplementary way of healing. I think the central message that with both of these persons have understood is that they have understood this distinction that cure and healing are two different things. And in healing, it is the body, mind, and soul whose harmony has to be achieved. Dr. Murat Tuzcu has sensed this. He has seen this in Dr. Kapadia, and he is hooked to it. And he said that, yes, this has to be done to improve the overall health. So a professional, and when professional becomes a committed person, he becomes a volunteer. He or she becomes a volunteer. I see both these persons as volunteers in the society who with their professional knowledge provide the voluntary service. Not only providing service, they are the, as I have said often, Gandhi was a servant leader. These are the two servant leaders in the profession of cardiovascular disease-related medicine. So Dr. Tuzcu, I am so pleased and I am so happy that you accepted to be, and both of you will now provide us the delight, and then we will be very happy to, this is the first kind of a celebration which we are doing, and I couldn't have thought of a better combination of the panel of you two to celebrate this Universal Healing Day. Welcome to both of you, and I now request Dr. Murat Tuzcu to initiate the discussion with Dr. RameshKapadia. Thank you very much for this opportunity.
Thank you very much, Dr. Iyengar, for your very kind and warm introduction. And then I am just absolutely delighted to be in the company of my friends, Dr. Iyengar, Dr. Shah, and then Mr. Radia, and of course, Dr. Kapadia. My only sorrow is that I am not together with you in person, particularly in these auspicious days of Navaruti Festival that I have been there before, and I hope that in the future we will get together again after these difficult days go by. Now, I was thinking Dr. Kapadia's career as a cardiologist, that is, after he finished his training in United Kingdom and did a higher training in United States, and although they wanted to keep him there, he got back to his home country and then started his career. A few years later, I entered to the medical school, and shortly after, I started to work in a heart hospital. And about almost for 48 years or so, I have been taking care of or touching to the patients with heart and blood vessel disease of all kinds. And I was witness as Dr. Kapadia and even the Dr. Kapadia Jr., that's Dr. Samir Kapadia, this incredible change and transformation in modern medicine. But I have to say that the understanding of the impact of the mind on the body and the link between the mind and the heart has not been explored to the extent that all the other technological advances, drugs and devices have benefited. So when I visited India about 15 years ago, Dr. Kapadia was so kind. I was in Mumbai and putting me in touch with one of his old mentees. And I personally witnessed early morning a group of patients who sustained heart attacks in the past and were getting together for this universal healing program. I firsthand saw the humility, modesty, yet determination of exploring what else can be done. In addition to the medications we take, or some of us, we had surgery or underwent stenting, but what else can we do? How else can we free the power of the mind on the body? And then I think that that Kapadia realized the combination of the modern medicine with the spiritual aspect and the mind aspects, because he realized early on how we live really determines what kind of health we have. So he devised this program and really grew this program. It wasn't static. And then what I admire about Dr. Kapadia, he doesn't deny the role of what surgery in the proper way of doing a bypass surgery when it's required. When somebody is having a heart attack, that they should need to have an angiography and perhaps stenting, and they should take statins, they should take aspirin. But at the same time, the UHB is no less effective, no less important. So combining that and trying to educate all of us in that regard was a fantastic way of spending a legendary life. So now I'm going to start with Dr. Kapadia, if it's okay with you, from the beginning. What inspired in 1980s or 1990s, Dr. Kapadia, that put you in this path of UHB?
Very frankly, I would say that it is a providence only, because I was treating the patients in my own way, because I was trained in UK and USA when there were no interventions. But the management was so effective that I could see from my teachers the same thing I had imbibed so well, and I was very successful in my practice. All of a sudden, I tell you, it's providence only that I had a chance to meet Dr. Larry Doshi. And he came to India for medicine and non-violence. Now, what a subject. So when I met him, I thought I have met a person which would really, a person who had such a great approach to life that I immediately fell in love with him. And then he introduced me to Dr. Ramesh. And I had an occasion to see his patients, 40 patients who had triple vessel disease and they had not undergone bypass surgery, and they were doing so well. So I got a stimulus to my approach. I added that approach to my regular practice. And that's how this program came to me. And not only that, when I started the program, I requested all the participants to continue their medical management. But when they did this program for about 6 weeks, they found that their medical treatment was more effective. Not only that, their spouses told me that they had improved in their temperament. They were more cooperative, they were less hostile, they were friendly. So that inspired me right at that moment when my assistant who was conducting the program told me that this is the change. I at once thought because this is universal healing program. The word universal healing program also came from the Providence. I did not think even for a minute, even for 30 seconds, it just came as a universal healing program.
That's fantastic. And then when you started, when I'm thinking early 1990s, that was the time that bypass surgery was being used very widely. And sometimes now we realize that perhaps a little excessively. And the stents were not known or were not widely used then. And then just tell us a little bit of how your practice was, and when you added the Universal Health Program, how it changed your own practice in those days.
Oh, yes, yes. My practice was on those lines only, but I got a great support. I felt that what I was doing was very right. And then when I added the program, I could easily see that my treatment was more effective. And a large number of patients who would really go for bypass surgery, they were all very well with our program, and the ejection fraction of the left ventricle, which is the most important thing, which gets affected after heart attack. Now, the normal ejection fraction, everyone who is listening to this program should know that the normal ejection fraction is 60%. 60% is 100%. So it's 60%. And those people who, after recovering from heart attack, their ejection fraction is more than 40, then they do not require any bypass surgery for improving the survival. So the survival benefit is not there just by doing bypass surgery. They could do as well, and in many ways better than going for easy solution like bypass surgery, because bypass surgery does not teach the persons how to avoid the heart attack after getting the bypass done. So many people I have found, especially in India, is those who get bypass done, they feel that they have done their best, and now there is no fear of getting another heart attack. So that was such a false belief, because when you spend a lot of money in a poor country, you feel that you have done your best. So that was the thing which I had to explain to a large number of patients. And I was so lucky that I came in contact with a very prominent cardiologist of USA. It was again a divinely arranged thing. And when he saw my work and got satisfied, that gave me a lot more encouragement and stimulus. And that really gave me such a confidence and such a strength that I continued this in a very, very confident way. And today I can tell you with a lot of confidence that I won't be surprised that a time, because everyone knows that the rate of bypass surgery or the bypass surgery treatment is getting less and less and less. And I would not mind taking this opportunity to say, and once when I was talking to Dr. Ramakant Panda, he also mentioned in the same way that one day might come when bypass surgery will go down in history, because it's already getting less and less.
Well, that's a fantastic aim, even though we should all aspire to that. I think we have some way to go. What you just said a few minutes ago really resonated with me. All over the world, what we expect from modern medicine is really with a magic wand fixing the problems that occurred over a year's time. I generally tell people, to my patients, that human health from the chronic disease standpoint is just like a country's economy. There are so many variables interacting and always changing and always interacting with each other. It is impossible to change it with a magic wand. As you said, bypass surgery, when it's done in the appropriate way, in the appropriate patient, it works, but it can't work by itself because it addresses blockages. It doesn't address the underlying disease process. So, Dr. Kapadia, in your practice, in addition to your universal health program, which is very, very effective, What else do you use? Do you use medications? Because I know that you are also an expert of modern medicine. Why say a patient with previous heart attack comes stable, you enroll him to the program. What else do you do? How frequently you see him?
Well, let me tell you, that my faith in modern medicine is really getting better and better, stronger and stronger. I feel that the medical treatment is evolving in such a way that we will be able to treat large number of coronary heart disease patients without any intervention. In the first few hours when the heart attack is about to occur and we do angioplasty, that seems to be a right measure at the moment. But afterwards, when the person has recovered, and I remember my teacher very well, a very prominent teacher in UK, when I passed my MRCP in cardiology and when I was coming home, he said, Dr. Kapadia, I have been very happy with you. You've been an excellent student, and now you are going home as a cardiologist. And I would like to tell you one thing, just one thing, that when you see the patient of heart attack, you will be seeing him after 1 day or 2 days. You won't be seeing him during the heart attack. And then if he's alive after recovery, after 4 hours, 5 hours, or 1 day when you meet him, then remember that he's going to be alive. And with that confidence, you treat the patient. And I tell you, that golden advice has helped me so much that I can dare tell that those who came under my care, they did not die. It means they did not die of heart attack in that year or following year, or that they led a very, very useful life afterwards. In beginning of my practice, when I started 55 years ago, after about 3-4 years only of my practice, I used to see patients very frequently, that is every 2 or 3 months for follow-up. And I used to keep my charges for follow-up very minimum. And I used to thank people who came to me according to my appointment. I said that you are doing me a favor that you are keeping the appointment and let me learn about this. And that way, some patients, I tell you, you will not believe it. I mean, 7 years of practice only first. Some 200 people who had come under my care, they said that, doctor, we feel better than before. And thank God we had a heart attack. Can you believe that? And I tell you, you have to believe me that I've heard this and I have said this in one of the conferences in Mumbai in 1978 when Mr. Morarjibhai Desai was the Prime Minister. He inaugurated that conference. And I tell you, this is absolutely true. And my confidence in treating heart patients now is getting more and more and more and more and more, strong. And when they come to me, they are half cured because they've heard from thousands of patients. Each person who comes to meet me now tells me that at least 7 to 10 people have told me that we have been advised bypass surgery about 10 years ago and now we are doing so well. So that word of mouth from 10 people who have recovered is such a strong word that when he comes to meet me, he's half cured. And then, see, people forget that coronary arteries are such sensitive arteries. And the circulation to the heart from coronary arteries is of such a great importance. And coronary arteries get narrow because of the disease, atherosclerosis. But it is also very sensitive to all emotions. Fear constricts it. Confidence dilates it. And the blood circulating in the coronary arteries also vary in consistency from second to second. If you are joyous, if you are happy, the blood is thin. If you get angry, the blood gets thicker. So all these variables which are there in coronary arteries are really fascinating. Now, there is an oculostenotic reflex in the doctors who have been trained in this last 25 years or 30 years since the intervention has become a very famous way of treating. that when they see a block in the coronary arteries, the patients as well as the doctors feel, how will I remove this block? So that is a very nice word coined in the United States. It's an oculostenotic reflex. As soon as they see the block, both the patients and the doctors feel, how would I remove the block? But let me tell you lastly, that we never remove the block. Now that is to be taught all over the world and by all the cardiologists. Now, because how can you remove in bypass surgery? We don't remove the block. We just plant a new artery around the block. In angioplasty, we don't remove the block. But by the side of block, there is a little space from which the tiny stent is one and is dilated. So this teaching is also extremely important, that the blocks which are already there do not give rise to heart attack. And recently, just to cite one example, that 21 years ago, a patient came to me with triple vessel disease, but his ejection fraction was 60. That means he had a natural bypass done. And with my name, he came to me. He said, triple vessel disease. They told me that we won't be able to go home. Please get the bypass done. But I heard your name and came. I've been treating him for the last 21 years, and he's feeling better and better and better and better. Recently, he climbed a mountain about 5,000 feet, came home, and he said that I did not feel anything. I said, continue your treatment and confidence. I like it very much. But then he had an idea planted by his very clever grandson, who is studying now. He said, Tonton, all your blocks must have gone now. So he did the angiography again, and all the blocks are present. That is to be understood by everyone who is dealing with heart.
This is, I think, a very, very important topic. If I summarize what I understand from your teaching, which I think that should be taught in every medical school, that if somebody is having a heart attack or an impending heart attack or an unstable condition that despite all the efforts with the medication can't be relieved, then I think those patients will be perfectly treated with bypass surgery or stenting or whatever. But that should not be left alone, and that should not give the confidence that a person is cured and then they are immune from future heart attacks. Or just the contrary. I think both the medical aspect of it by medications and also the lifestyle and also the spiritual aspect and the mind impact on the heart should not be forgotten. But people should not be subjected to bypass surgery or stenting as long as they are stable, as long as their heart is well controlled with a program like yours. Just because they have blockages, that is not an indication. Recently, there was a large study that demonstrated that if patients do not have unstable disease, if they have stable disease, the treatment by medication rather than stenting or bypass surgery did as well. So I think that you were well ahead of your time, but the recent studies have provided support what you're saying. Let's now go back and talk about it. There has been so much evolution in the medical field, but I would like to hear about your details of your program. I know that one of them is what your son mentioned is Savasana. Can you just tell us a little bit more details about your particular program?
Well, our program, you see, let me very briefly tell you that I do not know what my association is with Mahatma Gandhi. And we are celebrating this program at the moment and calling it a Universal Healing Day, occurs in his 150th birthday anniversary and the centenary celebration of the Vidyapith, which he established in 1920. And there is no end to what I can tell you with my association with Gandhi. I do not understand at all. The person who joined Gandhi at the age of 5 because his father was with him, Narayan Desai, he remained under my care for heart disease for 25 years. And every time when he came to meet me, I told him that my fee is that first you tell me some good incidents which are very instructive incident with your contact with Mahatma Gandhi for such a long time, because he joined him in fight and he was there till his death, 1948. So he used to give me such great examples, And from that, I began to have more and more confidence in my approach. See, my approach, I call a Gandhian approach, because the talisman of Gandhi was that whatever benefits the last man, that is the thing which is going to remain permanent. Now, that's why I'm confident that there is no need for fear of expenses when coronary heart disease. I'm convinced beyond doubt. How can I have any doubt whatsoever? Because I do not have any way of advertising my work. My advertising is only word of mouth. And that is so strong that, believe me or not, as soon as they come, I do not even realize that he is my old patient or he is my new patient. Because when he comes in, I do not hesitate to tell you, that in India, there is a way of giving respect to the people. They just come and just touch me with respect. And I feel that he might be my old patient who has now been benefited, therefore he has come. But then I realize that he's a new patient. Now, what a thing, then how can he remain ill after my advice? And fortunately, I know the basics of treatment of coronary heart disease. Nobody can question that, because I had such a great training in UK. I tell you, those days in UK for 5 years I spent were the best people, were the best days in the whole world. Macmillan said that we never had it so good.
Yes.
The health system in that time will never return. There,
Yes.
the patients never felt that they were that now what will be my expense or what will happen to me. When they went to the hospital, they were in agony with the pain. But as soon as they recovered, then there was no fear of anything.
Yeah, you always talk about, that's interesting. I want to get back to, I'm sorry interrupting, get back to you emphasize the importance of giving reassurance to the patient, giving patient so that he feels confidence rather than fear. That I think that works very well. Can you just say a few words about that?
Yes. When you remove the fear, you see the fear has got, on the coronary arteries, the fear causes a constriction of the artery. See, when you treat a fracture of the leg, you put it in plaster, and then it rests for 6 weeks and it's all right. But there is a fracture in the heart, there is a heart attack, the muscle of the heart is been damaged because the blood supply has become curtailed. Now, in such a situation, you can't put a bandage on the heart. So the bandage on the heart is the doctor's reassurance, the way in which he deals with the thing. And therefore, and when you say, we don't know what can happen, anyway, we'll do our best. And some doctors now, they have learned how to reassure you. They think that they talk to the patient very well. And then they go out and tell his wife, yeah, I told him, but I tell you, these 3 days are dangerous. They don't realize that if you tell the wife even 1 mile away, 1 kilometer away from the patient, that also will travel and come and change his cardiogram. We have done this experiment. We were looking at the cardiogram, and then the patient was happy. And when they were told, the relatives were told about 500 feet away that, the 3 days are difficult, and then the cardiogram changed.
Yes.
So this is a very, very, very important thing. Reassurance and fear constricts the artery and makes the blood 100 times thicker.
Yeah, fantastic. Yeah, I completely agree with you, and I learned this from you very much. Thank you. Tell me a little bit about what is your recommendation to your patients for if they say, doctor, what should I eat? What should I avoid? What should my diet be? How do you advise them?
Now that is a question which is very common with everyone, that what should I eat? I only tell them 2 things. I said, first, you must have a personal weighing machine in your home and weigh yourself daily. Supposing person comes with 110 kilogram and he said that he was all right, but for last 6 months I've been feeling a little discomfort. I met so-and-so and they did my angiogram and they said that you require bypass surgery or some intervention. He had heard my name and he comes to me. Formerly, when I started my practice, I used to find out what his ideal weight should be. And then his height and weight, I calculated and told him that, oh, 110 kilo is too much and you should reduce it to 85, 90 kilo. But now I'm wiser. That is not the way you deal with it, because he tells me that with 110 kilos, he was all right till 6 months ago. So I tell him that, look, 6 months ago, you were able to do this, but now you got this problem. So first thing you do, you reduce the heart function, reduce the need of the heart to feed your muscles or feed your body. You just reduce by about 3 kilograms when you come to meet me next. So that will make a difference. But if you put on even 500 grams or 1 kilogram, then it will be a greater burden to the heart, because that part has to be supplied by the heart. So then from ideal weight, I changed to the weight which will be comfortable to him, and the heart will be able to manage that weight. That advice helped so much that people got encouraged. And the other thing I said was that when you diet, it's common knowledge. Even the normal student knows that you should not take excessive fat. So I said that you reduce the amount of fat in your body. But and the other thing which people do not understand, that the sugar intake or the carbohydrates are as harmful as the fat. And anything which is fried over and over again is bad. So the outside, restaurant food, that should be avoided. But you did not control your taste to such an extent that it gets boring to eat. So you continue that, but with a little wisdom, with common sense, that every ounce of your body or every pound of your body, to be alive, the heart has to work. So that if you reduce the weight even by 2-3 kilograms, then the heart will feel better. And when the people get very much better and very much improved, and when they come to me, now I'm fine, I tell them, then he said that, but if I climb the stairs and with my 5 kilogram or 2 kilogram bag, then I feel a little discomfort. I said, that's very easy. You remove the 2 kilograms from your body, then you'll be able to carry that 2 kilograms.
Yeah, that's great. I love that. And I think I love that. And I think that what you said is absolutely correct. We should erase the word diet in our communications with our patients. We should rather use the term that what healthy eating habit. So I tell my patients that you shouldn't diet, but you should eat in a different way and get used to it so that you can sustain the weight reduction that you obtained. Now, let me just go back about 15 years or so, when you kindly sent me to that UHP meeting in Mumbai, very early in the morning. I was very impressed. So I want you to spend a few minutes to talk about the importance of talking among the people who had this heart problem or who want to avoid it, the group discussions. And also, of course, the hallmark or the central savasana that you champion. Just spend a few minutes to tell us about that.
Very, very important question. This also came accidentally in my life. I didn't know the word yoga, or I didn't know what yoga meant. But I can tell you the origin of word yoga. Yoga is Y-U-G, you, that is connection. So what yoga means, that you feel connected with people, you feel connected with the whole world. That is the idea. Now, Patanjali was a father of yoga, who wrote thesis on yoga and who was called the father of yoga. He has never mentioned any physical asanas in his treatise. No physical. He said that Chitta Vritti Nirodha Yoga. Now, in English, it is that if you Chitta Vritti, that is your mind and its instincts and the way in which it thinks, the Chitta Vritti Nirodha Yoga. So that control of mind. Now I tell you, if somebody tells you that he will control his mind, it is impossible. It's like a monkey. You cannot control the mind. But our father of medicine, Hippocrates, he said, and even Charak, the father of Ayurvedic medicine, he said that the mind is not present over the shoulders in your brain only. It is present in every cell of your body. And therefore, if you relax the body, the mind automatically gets relaxed. Now, that was a wonderful teaching I learned from the yoga teacher in United States. He was a very acclaimed teacher, but he explained to me that controlling the mind, you have to control your muscles of the body or everything. Now, so when you relax the muscle, the mind automatically relaxes. Another thing he taught me, that you cannot relax the muscle. He said, you ask anybody to relax his hand, relax a little more, relax a little more, relax. In the process of relaxing a little more, he will unconsciously stress it. Now you ask him to make a little pleasant fist, not a pleasant fist, and just feel which muscles are being stressed in fist. Just keep a feeling which muscles are, and a pleasant fist, and then let it go. And the relaxation is complete. So it's a prior stretching is so important for achieving a good relaxation. And that is a mantra of our whole exercises which we teach in the Universal Healing Program. As I told you several times, I've told you, Universal Healing came as from the heavens, the word. But when the program was of stretching and relaxation exercises, now the first exercises in standing position was stretching the hand. Now in school, when we learned the physical training, we used to say that you must stretch it properly, stretch it like that. In my program, in our program, on Universal Healing Program, what we teach is that when you do this, if you have got shoulder pain or something, you will raise it this much or this much, does not matter. But when you raise it, you bring your awareness to the muscles which are being stretched, coming to the present moment. Now that is the essence of Universal Healing Program. It is so simple. And because it is very simple, it is becoming very difficult for all the learned people to learn. I tell you, simple things are very difficult to teach. Hard things you can teach very easily. And people who have got lots of knowledge of yoga and asanas and all the things about all spirituality and all that, very difficult to teach them. But a very plain mind of a rickshaw driver or any laborer, or even a person who is very, ordinarily educated, very easily understands that when you stretch the muscles, then you don't worry whether you can stretch this much or this much, but you bring your awareness to the muscles which are being stretched. And then when you relax, bring your awareness to the muscles which are being relaxed.
Fantastic.
Now that is the thing. And when you do that with the whole body, then automatically the whole body is relaxed. And when the body is relaxed, the mind is relaxed. And when the body and mind are relaxed, and when you sit in that, you lie in that position, your body and mind are relaxed. And then you bring your awareness to the nose. No different type of breathing. You are breathing all the time, but you bring your awareness to the breath, and like that. Just become awareness. Don't change the breath. It's going in and coming out. Now you are aware. Now, when you become aware with the breath, without your knowledge, you become one with the whole world. Because tell me, this air, I am talking to you just now because I am breathing.
Yes.
You are listening because of breathing. All our participants at the moment are also doing that.
Yes.
So that becoming one with the breath, which I teach after relaxing the body. And after relaxing the body, how to slightly stretch it, then relaxing. So this is the mantra of Universal Healing. And I tell you, it is so effective and so very essential for that. That is a side effect, a pleasant side effect of program. Instead of helping everything in the body, we brought the awareness that we are all one at one level. That bringing awareness, that is the greatest side effect or the best effect of the program, is that universal brotherhood. We are all one at one level. that came, and that was a great thing. And I'm just fascinated with it. Every moment of my life, I feel that Gandhi came again, and he said that we are all one at one level, and let us learn that. And I tell you to mention, I should not have mentioned it, but this whole effect which is coming now which is affecting rich and the poor and everyone, is also bringing our awareness to the thing that we are all one at one level.
Yes.
Let me pray that this our program and this communication brings about this message very clearly to the people.
Yes.
Oneness and in this Gandhian year.
Dr. Kapadia, that was, I think, a wonderful summation of being one. And then we understand that both by the change in the climate and then this tragic pandemic, and how really not only humans, but together with all the living creatures, I think we got to realize that we are one. We just came to the end of our program. We have about 1.5 minutes, maybe 90 seconds. I have a specific question. Say, I know that your patients and the word of mouth, you are already well known. But if others wanted to reach out and learn more about it, what are the resources that they can take advantage of? For example, can you tell them about your website and then the books and other things that are available? We just have maybe a minute, if you don't mind, just quickly summarize those.
I know. That is my dream, and that is my aim, and that is the thing, that this program, along with our mainstream medical management, which is getting better and better and better, becomes such that we remove the fear of this disease, and also primary prevention also should get a boost, because now we know so much about coronary heart disease. We know so much about the etiology, the way in which progress is, and thanks to people like you and Dr. Nissan and so many people who have done great research in this, that primary prevention is possible. And that my aim for the rest of my physical existence is that let us make primary prevention throughout the world so that the disease, the incidence becomes less. So this primary prevention I'm going to emphasize so much. And then the treatment will become very, very easy. And so this is now your question
Just, I just want to make sure that we can point the listeners and the participants to more resources.
Exactly. I'm very proud to tell you that recently a doctor qualified with highest qualification, so-called in India, this DM cardiology, and they become busy with angiography, angioplasty. But he comes to my clinic and waits for 3 hours after receiving a gold medal in the examination pass and tells me that, Dr. Kapadia, I want to practice like you. Can you just help me and all that? And that doctor, I think he must be here in this conversation here, Dr. Dhaval Doshi. And I wish to have thousands of Dhaval Doshi, to come up and understand. And he has already understood within 5 years, he has understood. And he can do angioplasty and all that, but he has understood that this program or this way of thinking, this way of changing lifestyle, along with the efficient medical treatment. Now we have got such a great knowledge about the etiology of heart attack that LDL cholesterol, the low density lipoprotein in a family history, those who have family history, right from the age of 25, we should learn, we should teach, we should get that lipid profile done.
Yes,
and
absolutely.
Encourage that the LDL remains below 70.
Yes, Dr. Kapadia, I think this has been a wonderful exchange. I can't thank you enough in the name of our participants, particularly on the centenary of the Vidyapit Gujarat in the land of Gandhi, and with his teachings and with your teachings, we are grateful. And with that, I will conclude this portion of the session.
Thank you very much, Dr. Tuzcu. I must tell that a frequently voted by the National Register of Who is Who, the best physician of America, has done a wonderful interview of Dr. Ramesh Kapadia, This has been a sheer delight to all of us. And
Yeah.
I've learned that Dr. Murat Tuzu is a very confidence-giving examiner. I'm sure that his students don't fear him when they face their
Yeah.
examination because. And another thing, Dr. Tuzu, you have been interviewed so well by so many sort of media people, but you are an excellent interviewer, I must say that. And thank you very much. Now I request Professor Anamik Shah, who also happens to be a professor of medicinal chemistry, isolates molecules, does research on medicine, and also he is Vice Chancellor of Gujarat Vidyapeeth, to thank all of us on behalf of Vidyapeeth and Universal Healing Program. Professor Anamik Shah.
Sir, you are on mute. Anamik Bhai, you are on mute. Can you please unmute?
Thank you.
Okay.
Thank you, Sudarshan Bhai, Professor Kapadia, Dr.MuratTuzcu, Sudarshan Bhai, Radia ji, and all who have assembled on this webinar. I congratulate at the outset to Dr. Kapadia for a wonderful interview taken by Professor Tuzcu. We know that Dr. Kapadia is ever young, as we can see his enlightened face with permanent pleasant smile. On his birthday, let us congratulate on what we celebrate as Universal Healing Day. On behalf of Chancellor Sri Ilaben Bhatt, trustees and fraternities of Gujarat Vidyapeeth, we wish him long, healthy and socially serviceable rest of life. I am very happy to make few memorable remarks on this occasion. We have Ahmedabad Management Association and commitment people for UHP for several decades who are making this event memorable for all of us. Presence of Dr.MuratTuzcu, a world-renowned cardiologist. Friends, it is very interesting to note that the entire UHP program is started with blessings of Mahatma Gandhi's august and holy Sabarmati Ashram. It is in fact based on yoga and meditation. Though the person of modern medicine, he suggested a very simple non-surgical path for coronary patient, especially which is now very frequently in young generation. To save the young generation, this UHE program can be taken as in a very big way. It is based on compassion to the mankind and especially cardiac patient. It is also combining along with affordability of health solution to our people. Thus, in a way, it is a Gandhian solution to cardiac health. It is universal for all community of different race and caste. The learned audience present here may like to know that there are many places and cities where people met in a big community hall and follow universal healing program in the strength of hundreds of people and men and women. We are happy that we at Gujarat Vidyapeeth has started UHP center at our campus, and with generous donation of Dr.RameshKapadia's family and other donors. At Gujarat Vidyapeeth, we also have a long-standing of Department of Yoga Science, and we will in near future take up a research project for more scientific investigation-based UHP, so that we will put these findings to make UHP more acceptable in India and in the rest of world. I remember and sum up with the note sent by Honorable President of India, Sri Pranav Mukherjee, on occasion of the event, that UHP is a simple body, mind and soul regime to heal and prevent deadly patients such as coronary heart disease. It is a Gandhian character in its origin and content. UHP enhances the natural healing capacity of individual without compromising on the quality of life. Gujarat Vidyapeeth assures the world community for this cause with more emphasis on people and younger generation to save them from the sudden deaths. I congratulate for the wonderful conversation and advisory between the two very eminent personalities discussion the pleasant practices and benefit of UHP. In the post-pandemic COVID-19 era, this day is very important for all of us. I am thankful to all for arranging such a nice event on birthday of Sri Ramesh Kapadia ji. I wish both Dr. Kapadia and UHP a long time service to mankind. Thank you all. Over to Sri Radia.
Thank you. Thank you. Once again, I thank Dr. Anamik Shah is thanked, but personally, on behalf of AMA and Vidyapith, all the panel, Dr. Kapadia, Dr. Tuzcu, and as well our great stalwarts from Gujarat Vidyapith, Sudarshan Bhai and Anak Bhai. And once again, all the participants, it was a really wonderful event. And yes, as you said, UHP will continue to do good work, which will be benefiting the humankind. Thank you so much. And once again, Dr. Ramesh Kapadia, wish you a very, very great happy birthday, now known as the Universal Healing Day. Thank you.